we talk about respiratory disease. In respiratory disease, first of all, we go to pneumonia. What is pneumonia? Pneumonia is defined as inflammation of the lungs caused by acute infection and is characterized by recently developed sign of consolidation both clinically and radiologically. So what is pneumonia? Pneumonia, inflammation, most of that things. Inflammations of the lungs caused by acute infections and is characterized by recently developed sign of consolidations. Both clinically, we can say that the patients say that the symptoms and radiologically, and we find the disease by X-ray or others. So pneumonia is that inflammation of the lungs caused by acute infection and is characterized by recently developed sign of consolidation both clinically and radiologically. So what is the type of pneumonia? So there are 4 types of pneumonia. Community acquired primary pneumonia, typical or atypical. So community, further all 2 types they are divided. Primary primary pneumonia, they are divided into types, typical and atypical pneumonia. Number 2, hospital acquired nosocomial pneumonia, aspiration pneumonia, pneumonia in the immunocompromised host including asymptomatic immunity disease syndrome. So there's the 4 types of pneumonia: community, hospital, immunocompromised, aspiration pneumonia. So community acquired pneumonia, it occurs previously health individual. Normally, pulmonary defense mechanism prevent the development of lower respiratory tract infections. Community acquired pneumonia occurs when there is defect in normal host defense mechanisms. Number 1. Number 2, there is a large of infection inoculum. Number 3, highly virulent pathogen defect immunity. Presentation may be typical or atypical. So there's the 3 way to cause community acquired pneumonia. First, normal host defense mechanism defect. If some defect occur, or large infection inoculums or highly virulent pathogen defeat immunity. So the frequency of pathogen pneumonia, infection agent frequency 50% Streptococcus pneumonia. So that's the most involved pneumonia. Other is mycoplasma, hemophilus, chlamydia, legionella, bacteria. So that's the all type of pneumonia. Mycobacterium tuberculosis. Important cause of pneumonia in countries where tuberculosis is common, just like Indonesia and Pakistan. Viral influenza, parainfluenza, respiratory, synthetic virus, and measles virus. So we talk about community acquired pneumonia. And community acquired pneumonia have both 2 types. So first we talk about typical pneumonia. In typical pneumonia, feature onset mostly caused by Streptococcus pneumonia. Typical pneumonia, we talk about typical pneumonia. Streptococcus pneumonia, most common cause of pneumonia, and mostly H. influenza, very rarely. Clinical features of typical pneumonia: fever, shaking, chills, and predominant pulmonary features such as productive cough with purulent sputums, chest pain, and sign of consolidation such as decreased chest movement, dullness, and percussion, increased vocal formitus, egophony, bronchial breath sounds, and crepitations. So lab will check leukocytosis chest X-ray, PG, or laboratory facility. So that's the investigations, clinical features, and lab diagnosis of typical pneumonia. So it is atypical pneumonia, mostly caused by Mycoplasma pneumonia, Legionella pneumophilia, chlamydia pneumonia, viral pneumonia, Coxiella varanti, Streptococcus pneumoniae. So what's the difference between typicals and atypicals? Difference between atypicals. Non-pulmonary features are predominant, such as gradual onset of fever and dry cough. In here, fever, shaking, chill must be. And typical pneumonia. Myalgia, arthralgia, muscle pain, arthralgia, joint pain, headache, sore throat, nausea, vomiting, and diarrhea are predominant. So they are the symptom of atypical pneumonia. Respiratory pain, chest pain, productive cough. So these are the same, are less marked as compared to the typical pneumonia. Abnormal chest X-ray displays minimal sign of pulmonary involvement on physical examinations. So we no check leukocytosis patient non-laboratory chest X-ray. So what is typical pneumonia? Typical pneumonia is caused by Streptococcus we talk about first, and less commonly by H. influenza. Patients present with fever and typical respiratory features such as cough, residency, sputum, and pleuritic chest pain. Clinical feature: onset sudden of sometimes it follow a minor respiratory infection of a few days duration. Symptom: fever rises 39 to 40 degrees centigrade associated with chills and fever. Headache, aching pain in the body and lungs, vomiting, confusion, and disorientation. Pulmonary symptoms: dyspnea, shortness of breath, cough, dry. Pleural symptoms: localized pain, abdominal type, chest wall at the site of inflammation, and aggregate coughing, deep breathing, or movement. An examination journal: patient appear with rapid pulse, rapid respiration, high fever, less dry skin, and herpes dualis. Pulmonary signs within 24 hours: decreased respiratory movement, short abdominal second per day, sign of consolidation appear, decreased movement of a big sign of chest, increased vocal firmness, dull notes on vocal resolution. So bronchial or insect breath sound, increased vocal resilience of fine crepitations. So that's the symptoms of typical pneumonia. So how we different from differential diagnosis. So that's the pneumonia or not pneumonia. We check for respiratory tract infections, pulmonary tuberculosis, congestive cardiac failure, inflammatory condition, lung cancer, pulmonary esophageal, acute allergic alveolitis, pulmonary embolism, bronchiolitis obliterans. Investigation, we further goes to investigation. Sputum examinations. So sputum examination by 2 methods. Gram stainings. Sensitivity of the sputum examination is 62% and specificity 85%. So there is the great difference in gram staining sputum examinations. We after goes to sputum cultures. So there's another type of investigations of pneumonia. Chest X-ray, necessary for the confirmation of diagnosis and for early detection of complication. Pleural effusion and empyema. So there's the Investigation of pneumonia. Blood CPSR, WBC count greater than 10,000 per cubic meter. More than 90% neutrophil increase in SR, 100 increase. We go to atypical pneumonia with severe bacterial infections. Blood cultures, serological tests. So that's all the investigations of pneumonia. So how we manage pneumonia? In analgesics, general measure we just relieve the pain. Analgesic for epidural pain. Pethidine injections 5 to 100 mg or morphine 10 to 15 mg NSAIDs. NSAID we use tablets, Doluvid, IBD 2 times daily. Fonstan, Port, TDS 3 times daily. Oxygens for all hypoxemic. If oxygen low, with patient. Oxygen more than 60 mmHg. Fluid oral parental fluid to correct dehydration because fever and high respiratory rate can cause dehydration. Cup suppression. Cup should normally be encouraged, but if the unproductive and distressing. Cup syrup containing codeine can be given, such as syrup pulcodeine. Antibiotics. We use antibiotic by empirical therapy, antimicrobial therapy. So antibiotic treatment of patients, we purchase of drug clarithromycin, step clariceps 15 mg, azithromycin, erythromycin, levofloxacin, doxycycline, amoxicillin, or ciprofloxacin, Ezetrol 250 mg. So that's the doses of antibiotics. Duration of treatment. Typical pneumonia duration 7 to 10 days, atypical 2 to 3 weeks. Treatment of hospitalized patients. And after we go to parenteral therapies, amoxicillin plus clavulanic acids, injection augmentin 1.2 gram IV 8 hourly plus clarithromycin injection clariceps. We use double antibiotics in hospitalized patients. Option 2, ciprofloxacin, and we use same dose. Clarithromycin. Option 2, ceftriaxone injection, rosine. So that's all the dose is same. Levofloxacin, ciprofloxacin plus clarithromycin. Option 5, levofloxacin plus amoxicillin. So there's the treatments of pneumonia. So all types of pneumonia are 3 types. Same treatments and same strategies used for all type of pneumonia. So like, share and subscribe my YouTube channels. Thank you.